correct. And I'm definitely not a fan of fluoride in our water supply because just like you said, you really cannot control the dose for individual people. And if you can't control the dose, then how can we ethically give a medical treatment to people who are not consenting? Yeah, I was taught in dental school that medication without consent was kind of a no-no. Um, but apparently it's okay for our water suppliers to do so. So yes, I have huge problems with water fluoridation just from an ethical standpoint. Not only can we not control the dose, no one is consenting to it. The only benefit is the potential tooth health benefit, the potential reduction in cavities. And I would argue that the benefits of that are not what they once told us they were. You can look at different countries, different areas of the world, those who fluoridated their water, starting in the 1940s and 50s, and those who didn't. And you'll notice that the rates of tooth decay decreased the same in fluoridated areas and non-fluoridated areas. So I really don't think that fluoride in our water was the key to lowering the rate of tooth decay in the world. It really was like everything else, like all the other communicable illnesses. It was better hygiene and better nutrition and lifestyle practices that led to that decrease. So if it's not that effective, we don't have consent, we don't control the dose. Well, is there, some of my colleagues would argue that, oh, what does it hurt? We're just helping people. Well, now there's some pretty clear evidence that it actually does hurt. There's some pretty clear evidence, even studies sponsored by the US government, the National Toxicology Program, found that you really can't determine what a safe level of fluoride is in our water. So if you go back and you look at some of these studies, they're correlating increased levels of fluoride with a decrease in IQ for our kids. That's just not acceptable to me, and I don't understand why it's acceptable to any of my colleagues. So yes, I have loads of issues with water fluoridation. I'm excited for the 2 states in the US that have decided that they're going to stop it at a statewide level, but we have much work